have we seen an uptick in, say, psychiatric drugs since the beginning of the pandemic?
Yeah, I mean, it's been a dramatic increase yearly. So even before the pandemic, you just see each year their sales continue to increase. The number of people who identify with a mental health diagnosis increases. The amount of psychiatric drugs increases. But yeah, it spikes during something like the pandemic, right? Because we're isolated and there's more fear and fear provocation. And, we're kind of conditioned, mass conditioned. We go to our doctors if we don't feel well, and the doctors are just handing out those prescriptions like they're candy, like
Yeah.
without even providing informed consent. Over 80% of these drugs are prescribed in primary care settings by primary care doctors who aren't specialists in this area, and they certainly do not have a grasp of the literature base, the science that supports their use, the substantial risks, how they came to market, and they're not really strong at evaluating mental health problems. I mean, you cannot evaluate somebody and understand what they're going through in 8 to 10 minutes, which is the typical primary care appointment here in the United States. And so instead, it's become a fast food style of healthcare where you come into an American healthcare center, you fill out these quick screening measures, and it's a short conversation, and it's a prescription in and out, and it's obviously a very successful model for that industry.